Pete here with the smallbusinessresourcecenter.com and the Small Business Resource Center YouTube channel, your source for information on coronavirus issues, stimulus programs, small business help, and independent contractor help. So this information is about the coronavirus vaccine approval and the fact that it's actually closer than what a lot of people think. Basically, they have phase 3 testing expected by the end of the month. Keep in mind it's the 25th. Moderna has a COVID-19 vaccine that was tested on 45 healthy people between the ages of 18 and 55. 28 days later, a second dose was given. And with this process, they actually said they had 100% of the people develop antibodies. So they're expecting phase 3 trials at the end of the month, and that's pretty important. So the link in the description for this article will be here. Now, there's other companies also that are making vaccines, so there's potential that there's going to be multiple companies around the same time are going to have different vaccines. So there are the RNA, which is Moderna, Pfizer, and BioNTech, or BioNTech, excuse me. And then there's a standard type of vaccine, which would be Oxford AstraZeneca, from my understanding, which is a DNA type of vaccine. So when you're looking at that, billions of tax dollars are already allocated through the federal government for vaccines. Pfizer got a $2 billion contract on Wednesday. You're looking at other countries and what they're doing. China's actually testing vaccines on soldiers currently. Well, I don't know which company, but the news came out saying that. And the former FDA commissioner, Scott Gottlieb, which is now a CNBC contributor, sits on the board of Pfizer, and he said it should be out by early 2021. We're either going to have herd immunity, that's what he said, or we'll have a vaccine. But Trump also stated that they expect a vaccine by the end of the year. And actually, a lot of people are saying that we may have a vaccine by October now. That was in a Pfizer article. And then that's just recent. So it's a couple things to keep in mind. And I'm always like to talk about the science of things because this is kind of new. So what is an RNA vaccine? I always feel it's important if you're going to invest in anything or if you're considering taking a vaccine, you should know what it is. Because keep in mind, this is kind of a new thing, not vaccines, RNA vaccines. An RNA vaccine is a new type of vaccine for producing acquired immunity through RNA containing vector, such as lipid nanoparticles. Just like a normal vaccine, RNA vaccines are intended to induce the production of antibodies, which will bind to potential pathogens. The RNA sequence code for antigens, proteins that are identical to resembling those of the pathogen. So basically, from the understanding, just to make it a little bit simple, I'm going to check this article out on Harvard EDU. Basically, you get injected with a vaccine. The injection of the vaccine goes into your body, and it is an RNA type of vaccine, which is different than DNA. It produces an antigen, and it makes your body recognize the vaccine, or I should say the pathogen or the vaccine as something that it doesn't like, and it develops an immunity. So it has a immune response, which it memorizes. Now, if you get the actual thing like the coronavirus enters your body already recognizes that and attacks it. So it creates an immune response when you get this. The one thing I want to keep in mind that when they did the testing for the vaccines, like many vaccines, is a simple fact that nearly 100% of the people had a response which was not positive. That response, okay, basically the one thing I wanted to share about vaccines, which is similar to a lot of them, that side effects that almost everybody got was fatigue, chills, headache, muscle pain, pain in the injection site. And this actually happens a lot of time if you take a flu vaccine. There's a good part of the population that actually gets the infection. So it could be mild, it could be equal, but they did get side effects. And then, of course, they developed an immunity with the antibodies. So I'm just sharing the information. I'm not telling you to invest in any stocks, but you may want to keep your eyes on them because keep in mind this is a global problem. If you're considering taking the vaccine when it comes out, I always like to tell people they should know what they're taking. So this is Pete from the Small Business Resource Center.com. Smash a like button somewhere around here. Subscribe, hit the notification bells, and share this with a friend. Have a great day.